Okay, we're going to go ahead and get started. So hello, everyone. Welcome to today's webinar, and thank you all for joining. This webinar is meant to be a conversation between Work to Zero and AIHA. And today's webinar topic is about artificial intelligence and MSD prevention. Again, thanks everybody for joining. We're going to start by introducing our moderator and panelists here in a second, and then telling you a little bit about the AIHA Emerging Digital Technologies Committee and Work to Zero initiative. And then we'll jump into the content for our presentation today. We'll be hearing from our MSD Solutions Lab about using AI to manage MSD risks. And we'll be hearing from GE Appliances about their journey using AI-based tools in ergonomics. And then we'll end today with a moderated panel discussion. Please use the Q&A tab if you have any questions during the presentation, and we will try to get to all of them and get them all answered at the end of the webinar today. AIHA has a standard disclaimer statement about content that applies to our webinar today. So we wanted to make sure that we displayed that here briefly for everyone. So please take a quick look, take a few seconds to browse through the language. Next, we'll introduce you to our moderator and panelists who will be sharing their knowledge and expertise related to the use of AI towards MSD prevention. Our moderator for today is Mike Groh. Mike is the Director of Health and Safety with GE Appliances, and he's also the chair of the AIHA Emerging Digital Technologies Committee. Sarah Isher is the Senior Program Manager with the National Safety Council's MSD Solutions Lab, and she's also our EHS Manager. Nicole Irvin is the Senior Manager of Ergonomics with GE Appliances. So Mike's going to be our moderator, and Sarah and Nicole are both our panelists for today. Thank you all for joining us and for agreeing to share your knowledge. We're going to go ahead and start by turning it over to Mike to tell you a little bit about the AIHA Emerging Digital Technologies Committee.
Good morning, everyone. So the committee itself, we do develop quite a bit of technology-based items, whether those are professional development courses. We're currently working with AIHA's Technology Initiative Strategic Advisory Group to, I'll say, reinvigorate and get our IH calculator app back out there for both Android and iOS. So those are some of the things that we really do. And again, really trying to provide the information, the technology, latest on cutting edge. Any of you that may attend the AIHA Connect conference, typically in May, you see a lot of PDCs, a lot of pop-up talks, a lot of different things on emerging digital technologies that this committee helps to promote as well as deliver. So thank you.
Thanks, Mike. Next, I'm going to tell you a little bit about Work to Zero. So Work to Zero is a grant-funded initiative with the National Safety Council, and this initiative is funded by the McElhatton Foundation. And our mission is to eliminate workplace fatality risks through the adoption of technology. And I think this photo on the slide, or these photos on the slide, really illustrate the goal of Work to Zero. If we think about working from height, for example, there's been a lot of work done over time to implement safety precautions to mitigate risks associated with working at height. But we know that there's technology available today, like drones, for example, that can help eliminate these risks entirely in some cases by keeping workers' feet safely on the ground. So Work to Zero aims to better understand these technologies and provide information, resources, and tools to employers to help increase the adoption of technology. And now we're going to dive into the content portion of our webinar today, and I'm going to turn it over to our first panelist, Sarah Isher.
Hi, Katie, and thanks everyone for joining us today, and thank you for having me as a speaker. As she said, my name is Sarah Isher, and I lead the MSD Solutions Lab at National Safety Council. I've been with NSC for a little over 2 years, and prior to that, I was an industrial hygienist in manufacturing facilities. So AIHA is near and dear to my heart, and I'm happy to be here with you all today to talk about this topic. I'm going to be focusing on using artificial intelligence to manage musculoskeletal disorder risks. If you'd like to go to the next slide. So really, I only have about 15 minutes or so to speak with you all today. We're going to do a quick introduction about what the MSD Solutions Lab is and what we aim to do, a background on artificial intelligence and what we mean by that. Most importantly, I'm going to focus on what the relevance to MSD reduction is and how you can use this tool to reduce risks in your workplace. Also touch base on challenges and opportunities, which we always have those when we're working with technology, and then the future plans for the Solutions Lab. Next slide, please. So about the lab, really we're the MSD Solutions Lab powered by Amazon. We're focused on reducing MSD risks in the workplace, and we're really focused on getting groups together to talk about what's working, what's not working, and sharing that information. So you can go to the next slide. I'll touch base on why this matters. So as you all know, the challenge is really that employers are losing money, time, and talent to musculoskeletal, or MSDs. I'm going to call them from now on because that's kind of a mouthful. MSD injuries cost employers billions of dollars a year in worker compensation. Liberty Mutual from 2021 and 2022 shows that there's billions of dollars a year in worker compensation, lost productivity, and absenteeism. There's over 12 billion lost due to overexertion, 4 million lost to awkward postures, and almost 2 lost to repetitive motion. So obviously this is a risk and hazard that we want to really try to reduce in the workplace. And it comes down to, in 2020, workers in the US private sector suffered around 250,000 MSD injuries or illnesses involving days away from work. And the median lost workday on that was 14 days. So if you think about, your job being out of work for 14 days, that's why this work really matters. And we're trying to keep people safe at work. Next slide, please. So really setting the stage, we know that every worker deserves to work in an environment where their safety is valued and risks of MSDs are evaluated and minimized. Together, through the MSD Solutions Lab, we are trying to inspire a global movement across all industries that improves workplace safety, reduces MSDs, and also improves worker well-being. We know that the toll on individuals, families, and communities is tragic, and we believe that it is preventable. So, next slide. How are we trying to change that? The lab was founded on an employer initiative called the MSD Pledge. The pledge helps to create a community of businesses that can work together under the shared goals of reducing MSDs. It really focuses on 3 key areas: risk reduction, innovation and collaboration, and a culture of safety. Our aim under the inaugural pledge was to reduce MSD rates by 25% by 2025. We are quickly coming up to 2025, which is crazy. So we're really evolving our initiative to include other employers and have them choose the risk reduction rate that they would like to go for in their organization, because we understand that everyone has different focus areas and different levels of resources that they can tie to this initiative. So if you're interested, check out our website. It's nsd.org/MSD. We'd love to hear from you, and we also love to see more organizations sign the pledge. Next slide. So beyond the pledge, the MSD Solutions Lab was created to address the problem of workplace MSDs, and the lab is centered around 4 pillars to best address the issue. The Engage pillar aims to engage employers, workers, researchers, and innovators. This is achieved through our advisory council, made up of experts from across practices. We also have a research pillar, which aims to conduct impactful research and disseminate insights. We do this through literature reviews, white papers, and emerging topics, which I'm covering today. The solve pillar focuses on identifying, piloting, and promoting solutions, and this is achieved through our innovation challenge and grant initiatives. And finally, the amplify pillar engages safety leaders like you all across industries, and this is achieved through our MSD pledge. Next slide. So all of that to say, the reason why we're here today is to talk about artificial intelligence. So let's get into it. What is artificial intelligence and what are the types and uses? Next slide, please. So my colleague created this graphic and I really like it because it helps me at least understand what we're talking about when we say the word artificial intelligence and the different types and inputs that go into this process. So artificial intelligence is a field within computer science. It uses high-powered computing machines to create systems capable of learning, reasoning, and adapting to the behavior strategies based on varying data or conditions. And it really replicates the augmented human intelligence. What does that mean in simple terms? AI can carry the tasks done by workers, complement the work that workers do, and excel in tasks that go beyond what workers can do. Evaluating the performance of AI-powered models is essential to assess the impact of their algorithms. What's machine learning? Machine learning is a subfield of AI and computer science that centers on using algorithms and data to replicate the human learning process to enhance its precision over time. Deep learning is a subfield of machine learning and uses a customizable neural network that allows machines to handle large amounts of data and make precise decisions without human assistance. So more data yields better predictions, thus reducing uncertainty and improving prediction accuracy. So neural networks, also known as artificial or simulated neural networks, are a subfield of deep learning and form the foundation of these deep learning algorithms. They are called neural networks because they imitate how our brain works with interconnected units that communicate like biological neurons. What is computer vision? That's something I'm a little bit more familiar with. Computer vision is a field of AI enabling computers and systems to derive meaningful information from digital images, videos, and other visual inputs and take actions or make recommendations based on that information. If AI enables computers to think, computer vision allows them to see, observe, and understand. Neural networks and deep learning make computer vision more capable of replicating human vision. However, computer vision trains machines to perform these functions with cameras, data, and algorithms. We also have natural language processing, which is another field of computer science and AI. It really focuses on enabling computers to comprehend and interpret human language, both written and spoken. We also have predictive analytics and predictive modeling that are also terms discussed in AI. Predictive analytics uses statistical methods such as automated machine learning and AI to build models that extract insights and detect patterns. On the other hand, predictive modeling is a key component of predictive analytics, uses data mining and statistics to create models that analyze historical data, uncover patterns, and really estimate the likelihood of future outcomes. So I know that was a lot, but I kind of wanted to go over the background on what AI is, the different types of models, before we get into why it's relevant for MSDs. Next slide. So work-related MSDs remain a significant workplace problem, even as we stand on the threshold of Industry 5.0. Using technologies like the Internet of Things, big data, cloud connectivity, and analytics powered by AI and machine learning can be used to not only reduce risk, but also remove employees from hazardous situations. For example, by integrating the emerging technologies of Industry 4.0, workplaces can either automate work processes to eliminate specific tasks or use 5.0 technologies to reduce ergonomic risks. This collaboration between humans and machines enhances worker capabilities and elevates overall worker conditions, leading to safer workplaces. Building an MSD solutions program involves identifying and addressing existing MSD risks and hazards, preventing potential new hazards and risks, as well as medical management. So today I'm going to share how AI can help address these challenges. Next slide, please. The first way to do that is really to focus on hazard recognition and prevention. AI can be used to identify when, where, and why particular work and work environment show risk factors for MSDs. This approach includes surveillance for injury prevention and control to determine when and where risk assessments can be performed and where ergonomic interventions can be developed. These scenarios can further be classified as first, identifying risk factors for MSDs, really using machine learning and natural language processing. AI can be used to analyze data from various sources, such as injury reports, workers' compensation claims, and identify patterns that may indicate MSD risk. This information can be used to develop risk assessment models and predict the risk of MSDs for specific tasks. And I would say this is probably one of the most common ways that it's being used now, or at least what I'm hearing how it's being used. Another way is monitoring and analyzing data from wearable sensors to model the injury risk. This is through machine learning. So there was a Gartner report in 2022, which emphasized the integral role of AI in mobile and remote enabling technologies like wearables to reshape the workflows of frontline workers. So these sensors can be used to collect data on employee movements and postures, and then these data can be used to train an artificial neural network to model the risk of MSDs, which can then predict the risk of MSDs for individual workers or specific tasks. And then also you can predict work environment risk factors to identify jobs and specific MSD risks to improve workstation design and work environments using neural networks. AI can be used to analyze workstation layouts and identify potential MSD risks. This information can be used to improve workstation design and reduce the risk of MSDs. And finally, with this subset, MSD risk assessments and interpreting real-time camera images to alert workers if their postures and movements are potentially hazardous. And this can be done through computer vision. So vision-based algorithms can detect and track worker tasks, specific body movements, behaviors, and postures in real time through image processing and machine learning. This information can then be used to identify workers performing tasks that may be hazardous to their health, alert workers to risks and potential hazards, and provide timely feedback to them and help them improve their posture and movements. This prevention through digitization approach facilitates subsequent redesign of the tasks and worker education and training with the final goal of MSD risk reduction. Next slide, please. In addition to identifying and addressing MSD risks when building an MSD solutions program, it's also recommended to incorporate MSD medical management as part of injury prevention. So an MSD medical management program aims to prevent pain, impairment, and disability, and to ensure the safe return to work for all workers who do experience an MSD. So a healthcare provider like an ACMED doc bridges the gap between employers, workers, and the healthcare system. Therefore, an effective MSD medical management program requires collaboration between the employer, the employee, and the healthcare provider. So you might say, well, how can AI help in the medical management of MSDs? Well, we're seeing the early identification and intervention using machine learning. So AI can be used to identify employees at risk of developing MSDs. This information can be used to also provide early intervention and prevent MSDs. Another cool way is AI can be used for diagnosis and treatment using deep learning. So AI can actually accurately assess MSD prognosis, and the insights gained from AI assessments can inform patient treatments. So using predictive analytics, AI-driven systems can also assist healthcare providers in developing patient treatments. However, unfortunately, to our knowledge, there's no peer-reviewed published research exists on tailored medical treatments for workers based on AI-powered algorithms. So that's definitely something we'd like to see in the future. And lastly, AI can be used to facilitate return to work using machine learning. So AI can track the progress of employees recovering from MSDs. This information can help employees return to work safely and effectively. For example, machine learning algorithms can personalize recovery plans using injury diagnosis, history, and data. These recovery plans can adapt in real time, optimizing outcomes via accurate exercises, guidance, and real-time monitoring for strength and mobility. Since virtual reality replicates work environments for workers to practice skills in a virtual space safely, AI can also customize training and monitor progress. Next slide, please. And I think one of the best things about AI is it can promote systems thinking approach. So a systems thinking based risk assessment methods are better at identifying risk across whole work systems compared to just focusing on the individual work and worker related factors. AI in occupational safety and health also elevates systems thinking by using this tool to efficiently process complex work data, making connections and identifying patterns through predictive insights and data-driven strategies. Also, AI might reveal that a certain placement of a tool in an assembly line is impacting workers' reach. It then prompts the design of workflow optimization for the whole work process, not just focusing on how that tool placement is affecting that one individual person. And by integrating AI technologies with a systems thinking approach, you really are enhancing the identification, understanding, and management of ergonomic risks. Next slide, please. So with everything, there are challenges and opportunities. So I'm going to talk a little bit about some improvements that could take place and also some areas of celebration. Next slide. So there are within AI, technology issues, worker privacy issues, and also policy and regulation. So as far as technology issues, when computers first became a part of everyday life, garbage in, garbage out really became a common catchphrase, implying that wrong data will lead to wrong answers. This idea also applies to AI, but it's even more challenging since AI feeds on big data and is increasingly impacted by the black box analogy, which is really that since the input is hidden, it is not clear what the model is trained on or how outputs come about. This is really because many commercial AI manufacturers and developers either can't or won't reveal their proprietary models, interlogistics, especially with validation. So consequently, there could be potential biased data that's prone to discriminatory outcomes. The next is really worker privacy issues. So it's very important, obviously, especially with health data, to protect workers' privacy, consent, confidentiality, and data security, both for the healthcare provider, the employee, and the employer. So using AI-derived algorithms for workplace surveillance obviously generates big data. There is really growing concern that AI-driven workplace monitoring and surveillance can result in the misuse of data or introduction of bias in algorithms, really impacting the workers' privacy and trust in technologies. There's also research showing that monitoring workers may also result in the Hawthorne or observer effect, such that when workers are aware that their behavior is being observed, they might modify their actions and adhere to proper workplace practices, but aren't really changing their true behaviors. And then as far as policy and regulation, it's really important to safeguard workplace data, and it involves defining policies for how we collect and store this data, maintain it for accuracy, and also classify it for who's using it and what purpose they're using it for. So there's now this blueprint for an AI Bill of Rights. It's a framework designed to safeguard individuals while using technology, but we really need more efforts on AI-related policies and procedures to address potential ethical, legal, and different concerns. Next slide, please. So really, areas to celebrate. AI-powered algorithms play a crucial role in identifying, modeling, and mitigating MSD risk by risk factor identification, wearable monitoring, work environment assessment, and real-time visual risk assessment and hazard alerts. It's important, when implementing AI for risk reduction, to ensure that the AI systems are developed, deployed, and used responsibly, and you're sharing that with your workforce. And most importantly, AI models used in the workplace should be explainable. So this means that the decisions made by the AI system should be transparent and understandable to both employees and employers, so you can be successful in using this technology. So just to wrap up, future plans, next slide. You can actually hit it again. If you're interested in learning, what's next for the MSD Solutions Lab and what we're up to, we do have a research report coming out on this topic, so it will dig into each of these with actual use cases and then actionable insights for employers. We're also working on a DE&I and MSD white paper, as well as a non-physical risk factors white paper. Something you all might be interested in is our grant applications are now open. So we have funding available for both research to solutions grants for universities and industry partners, and then also pilot grants for industry partners that are using potential technologies. So if you're interested in that, let us know. And then also, much like Work to Zero, MSD Solutions Lab will be at the Future of EHS in Louisville, Kentucky in February, and we look forward to seeing you there. Next slide. If you'd like to learn more about what we're doing, or you'd like to contact us about the grants or any of these topics, email us at msdsolutionslab@nsc.org. And with that, I'm going to pass it off to Nicole to talk about their experience with AI.
All right, thank you very much, Sarah. Yep, so let's just jump right in to see our journey with these AI-based tools. So next slide, please. All right, so this is an overview of what I'll be speaking about today. First, I just want to give a brief overview of our company, GE Appliances, a hire company, then show you guys a roadmap of how we implemented AI-based tools, and then show you kind of what our Ergo program today looks like at GE, and lessons learned. There's any new program, there's always going to be new things that we learn and areas for improvement. And then at the end, I'll be talking about just kind of where I think we're going as an industry with these new technology. Next, please. All right, so a little bit, again, overview of myself. I studied industrial engineering at the University of Louisville. I have an undergraduate there. And then I studied applied exercise science at Concordia University, Chicago. Once I was in the ergonomics field for a few years, just to round out my educational experience on human movement science. And now I've been working at GE Appliances now for 10 years, and about half of those years have been dedicated to running the ergonomics program. Next slide. So again, overview of our company. We have about 16,000 employees across the globe. We have contributed to local economies in 46 states. Our appliances are in about half of all US homes, so it's very common that you'll see one of our appliances in your home or a neighbor's home. And then our parent company is called AIHA Smart Home, and you can see some of their stats down there. Next slide, please. And so this is our kind of a footprint of US-based manufacturing. We are headquartered in Louisville, Kentucky. That's where I'm located at Appliance Park. So we have 5 manufacturing facilities and a large warehouse all within Louisville. We have some other factories, make some other appliances for us down in some of the southern states, and we have distribution centers and service centers across the country. Next slide. All right, and then just to give us some scale of what our manufacturing pace is. So as a whole, we build 2,500 units per hour. We have a delivery of an appliance every 13.8 seconds. We recycle over 100 million pounds of cardboard, wood, and plastic. We procure 3 billion parts, and we ship millions of service parts, accessories, add-ons across the country and the world. And we have about 16 million calls through our call center. So it is quite a large reach. A majority of my scope of the ergonomics program is in the manufacturing space, where we have very fast-paced assembly lines and still a lot of people building our appliances. Right, next. And then just want to give a little bit of our house of brands. These are some of the brands that we create under our GE Appliances Hire company. So we have Monogram, Cafe, GE Profile, Hire, Hotpoint, and Opal ice makers too, if you guys are familiar with those. All right, next slide. All right, so this is a little preview of the AI-based tool that we are using. It is a computer vision system. It doesn't require any wearables, which is a nice feature, so that it's very non-invasive to the employee. So all we have to ask them is for their permission for us to record the work. We always emphasize we're recording the tasks and the workstation, not the worker themselves. And you can see that they have the face blocking, those black dots over all the people's faces, which is a nice privacy enhancement. And then it gives us a overall screening score based on the posture and the forces and the frequency of these tasks. And the tool that we've been using, it's called Human Tech, and it's part of the Velocity EHS suite of tools. And what I like about this tool is that you can see on the left side, there's baseline, gives you your starting point, and then it walks you very clearly through an implementation and problem solving process from baseline to what are your direct causes causing risk, what are some improvement ideas, what is your projected score if you're doing a trial, just kind of say like, if we do these things, what is our projected score going to be? And then finally the follow-up, when you actually implement a new solution, you can kind of compare the risk from the beginning to the end. All right, next slide. And then this is our roadmap of our journey. We started this journey back in 2021, where one of our factories kind of came across this technology. They were very interested in trialing it. So they approached me and said, hey, can we try this out and see what it's like? And we got the funding to do a year-long trial. So we bought one license for 1 year at Human Tech for one of our factories. We saw that it was a success. We wanted to kind of get through what are some of those limitations, what are some of the things we'll need to address if we wanted to expand it to all the factories. And we got some buy-in and got it into the budget for the following year. So in 2022, once we got all the terms and conditions signed off and our purchase order out there, we expanded to all 8 of our factories in the US. And then in 2023, that was last year where we had a full year with the system at all of our factories. We populated that system with a lot of baselines to try to see kind of where is our overall risk laying. We're not there all the way yet with all of our jobs. I don't know if we're going to quite ever get to that point where we have every job always evaluated up to date. But what we really want to do now this year and going forward is really focusing on that ergo risk reduction. So it's great to have all the baselines done, but if you're not going to do any improvement projects, then there's no really good use of having all your baselines completed for all your jobs. It's really where you get the value from AI-based tools is when you're actually implementing solutions and reducing that ergonomic risk. So our goal this year is to kind of roughly as our goal is to reduce ergonomic risk by 15% by the end of the year. Okay, next slide. All right, so then here's a little bit of before and after, some of the before problems we had with the more traditional ergonomic assessment tools. There was a lot of tedious measurements. It lacked some strong visuals. We had longer time to complete assessments, long reports. We had our ergonomic technicians drawing out these very long PowerPoint presentations to show what the risks were. There's a lot of, it just took a long time. And it also had a lower adoption rate. We had a web-based way to track all the assessments, but a lot of people still were using spreadsheets, using kind of their own local spreadsheets, which was hard to track kind of where it was our overall risk for as the whole company, which a lot of managers would always ask me, hey, where are our ergo reds? And I said, well, you have to go this place, this place, this way. And it just took a lot of time. So now that we have implemented this AI-based tool, we have the AR posture analysis. It speeds up the time for posture analysis because it lets the AI and the computer do that automated portion of it. There's a lot of strong visuals, so you can very clearly see what is the computer analyzing, because you can see those videos and have that video play back. So that's actually been very helpful for one-on-one coaching with operators to show them, hey, if you are reaching above your head all the time, that's not necessary. You can show them they have the shoulders or the arms will highlight red when it's in a poor posture, and you can show them that good coaching. That's been a good benefit too. Overall, I think it's a shorter time to do your baseline assessments so that now you have more time to go solve the problems, which is where we still need people to come up with these creative solutions, creative brainstorming, and now we have more time to do that because we're taking less time to get our risk analysis. Human Tech also gives us nice, concise reports, 1 or 2 pages at the most, and it's had a high adoption rate. We have now within the last year over 1,000 assessments done in our system. And before we maybe had 300 or 400 across the business. Now we have over 1,000, which has been great, a great improvement. All right, next, please. All right, and then this slide, I wanted to go through just some of the advantages and limitations because no ergonomic tool is going to be perfect. So again, some of the advantages, like I've touched on, we have more time to solve problems. It's been a really good internal marketing tool because it is a little more of the flashy and like, oh, cool, we're using AI and computer vision better for us, it looks cool. So it has helped a lot of internal marketing just to advertise our ergonomics program and what we're doing to help our employees stay safe at work. Again, like I said, we have a high adoption rate of this now, and it's a very visual tool. But some of the limitations, it is still a screening tool. It's not going to go into real in-depth analysis maybe on hand risk. So we do a lot of small electrical plugs or small hand-intensive tasks that this is not necessarily going to go real deep into any one body part, but it does do an overall holistic screening tool for the whole body. Frequency is limited. A lot of traditional ergonomic tools, you'll put in the exact frequency, how often are they doing a task. In our particular version of the AI tool, does not have that as a direct input, so that's a little more limited. And it is person dependent. So if you have a very short person and a very tall person doing the same job, it may give you different ratings. So those are just some of the limitations to be aware of. Some of the lessons learned that we've had is that we still need a robust ergo problem solving teams and training programs. AI is not going to do all the work for you. It'll speed up some of the parts of the work, but you will not be able to, it's not going to solve all the problems. We still need training programs. We still need problem solving teams and problem solving classes for our problem solving partners. Another lesson learned is that we wanted to involve IT security early. Cybersecurity is still a risk since AI is still new and it poses a threat, could be a threat. So we went through a lot of IT reviews to make sure that this third-party company that we're partnering with has all the proper firewalls in place and their cloud processing is secure. We also have turned on that privacy face blocking technology. There's also within this human tech tool, you can also blur out the background. So that basically all you're seeing is the stick figure. So if that is a concern for your company, they can block out the background, which is a nice feature. And we still need other tools in the Ergo toolbox. So we have more in-depth assessment tools for like the hands or lower back. So it's not, we're not getting rid of all of our tools, just using this as our screening tool. And then early communication is key for anything. We talked, some of our sites are unionized. So we talked to union leadership early on, especially about the employee privacy. We still always obtain people's verbal consent before doing the tool or before doing any video. If someone is not comfortable being recorded, we can find somebody else to step in for the job and to do that. Because again, we're wanting to evaluate the workstation, not the worker themselves. All right, next, please. All right, so this is just my predictions of kind of where are we going as an industry with these tools. Again, my own opinions and predictions. So I believe there's going to be improvements in the AI. It's still, since it is still a new, computer vision still getting better, I think that's going to improve, especially when you have multiple people in the view of the camera. Sometimes the skeleton can jump person to person. I've also seen it sometimes get confused that a part of the conveyor belt is an arm or a leg. So it gets a little get confused. So sometimes we have to redo the video. So I think those are going to get ironed out. I mean, just the improvement in the technology. I think the other thing that we need as an industry is improved ergonomic research now. We're still using a lot of the tools that were developed in the 70s and 80s. And there is now more recent ergonomic research coming out of universities, but analogy that I've heard with this is that we're taking maybe 5G LTE data, but we're putting it through analog phones. That's kind of what we're trying to do with this. We have all this cool data and new access to data we never had before, back in the day before computers were really so common. But we need our tools now to be updated to match those data capabilities. So I think that's going to improve over time. And then I think we could also use AI to help predict solutions as well. So I have a snapshot of some of another simulation software that we use, but I think AI can help predict those types of solutions early on so that we get to the answer we need faster. Not to say it's going to replace our ergo technicians or our training programs or problem solving creativity, but if it can fast track our way, then I think that would be very helpful. All right, next slide. And that is the end of my presentation. So I'm going to hand that back over to Katie for the Q&A.
Thank you, Nicole and Sarah, for your presentations. I'm going to go ahead and turn it over to Mike now to moderate our discussion and Q&A.
All right, great presentation, Sarah and Nicole. Really appreciate the insights. I mean, certainly, Sarah, I think just grounding everybody in, really what AI is and what it can do, the different aspects of it was very good, as well as really where, the NSC, Work to Zero initiative is really going. And we do have a few questions in the chat. I'll just say to all the participants, please keep them coming. We will get to them. I've got a couple questions that I'll go ahead and ask Sarah and Nicole. So first, I think that Nicole, you had touched on a little bit about the data privacy concerns, really with the solutions utilizing, that I'll say that web-based application. And certainly we're not here to promote any one particular software. There are other softwares that utilize AI tools to do ergonomic analyses. But so this, if you could just describe, I mean, I know what our process is from a digital technology, our IT team. But how much of a struggle was that getting that through our DT team, just knowing the I'll say the state of hacking and everything else, and if you can go ahead.
So I had an IT partner within our company that drove a lot of those security reviews for us. It did take quite a few months to get that all completed. I think the main risks of just the AI portion of it, and the computer processing in a cloud that's not necessarily a GE Appliances based server network, was something that they had to go through in depth. I know company we purchased the software web-based program had to provide a lot of documentation and reviews of their systems and their firewalls for hacking. The other portion of it was because we were using videos and pictures of employees. That was another employee privacy concerns that we had to go through. Another thing that we have every technician, when they sign in into Human Tech each day, they have to check off a box of the consent forms, and that they will always be asking for people's consent before video recording them, and that they're going to be deleting their original video once it's been processed off the original device that it was recorded on, which is typically their smartphone or a tablet. So we have that ingrained, that they have to check that off every day, that they're going back and deleting the original video for people's privacy. And then we also have those built-in privacy features where it has the face blocking technology always turned on. It's not something that the ergo technician has to remember to turn on. It's just always the default for our company settings. And they also, like I mentioned, they can also blur out the backgrounds if that is a concern for certain companies. If they have more proprietary manufacturing processes that they don't want other people to be able to see, they can really block it out so that all you're seeing is that human skeleton with the color-coded skeleton.
Great. Thank you, Nicole.
You're welcome.
And I guess, so, and I think both Nicole and Sarah, you both kind of talked about it. And I think, Sarah, this question's really, kind of building on, that whole AI black box. How is it actually processing these things? When we're looking at different AI solutions, ergonomic tools, how do we really know what is actually being used to do all these computations and this data?
Yeah, I think the first step is really making sure that you're using a solution provider that you can partner with. They can really help you through this process and hopefully explain to you how the information is being collected and how, whether it's Reba, Rula, however they're gaining these ideas of whether or not it's a good posture, bad posture, high risk, low risk. I think it's really having those conversations to begin with that provider to ensure that both how they're getting that information and how they're making the decision. So that way you're not just assuming that the solution is correct.
Right. Agree 100%. There was one of the questions from our participants, the name of the program that tracks the body movement. I believe the person was requesting the name of the Human Tech software. So I believe we've answered that one. If not, please respond again. Next person we did have a question about was these various tools, are they able to pick up and actually know whether the weight is too heavy for someone who's picking it up? So Nicole, if you can address that.
Yeah, so the way that it does input forces, that is still a manual input. So the ergo technician or the person practitioner has to go and weigh the parts that they are picking up, or if it's a forceful exertion, they have to measure what that push or pull or carry force is on there, and then they enter it into it. And because this is, again, just a screening tool, it kind of bucketizes that risk and says, is this generally a high risk, medium risk, or low risk? And that contributes to your overall score of your workstation. So then you can compare that to other workstations in the area to know if it is a higher risk compared to other workstations or a lower risk. And it doesn't necessarily tell you for this particular person, is this too heavy for them? It's just kind of part of the overall screening tool.
Great, thank you.
Mm-hmm.
Another question for Sarah. Again, I think one of our attendees, really asked, do you think it's possible that, over time we'll be able to develop, a threshold limit value? I know that's a ACGIH term, but a threshold limit value for ergonomic stresses, since, we can do full-time monitoring now.
I think it could be helpful through further research, and that's why we need more people to spend time looking into researching these types of tools and understanding through validation studies if it is something that we can continue to, draw correlations on. I guess we'll see, right?
Okay. No, and I think Nicole touched on that, just relating to, how heavily dependent we are on those studies from the 70s and 80s, really to do that. So it sounds like a lot more research needs to be done to bring that one to fruition.
Yeah, and I'll give a plug now. If you are a researcher or someone that is interested in this work, please apply for the MSD Solutions Lab Research to Solutions grants, so we can continue to learn more about this and further the field.
And add on to that, I know that academia has also they want to develop these tools, but they want to also validate them, and they need data from industry to validate, can their tools be predicting risk, either looking back at past injuries and it would have been able to predict high risk or low risk. I know sometimes that bridge needs to be connected, so that could be maybe another where another third party could maybe clean that data up so it keeps the company's data private, but also gives the universities the data that they need to validate. So that's another challenge of being able to come up with these new tools. I don't think it's insurmountable, but that's another portion of the validation of tools.
Great. So we had a specific question for you, Nicole, online. Have you seen a good correlation between the screening risk scores in the AI/computer vision technology and your MSD injury rates?
Yeah, that's a good question. I don't think we've had the tool quite long enough to do a large study on that. I know for individual tasks, we have seen, yes, we know this is been a high injury type of risk, and we see a higher score. What I'm more interested in too is saying the factories that are doing more of these risk reduction projects and in ergo improvement projects, are we seeing that correlation of more improvement projects with a lower injury score throughout the year? So I think we will know more of that in the next year or two when we have a little bit more data. So I think we're just a little bit premature on that for us.
Okay, thanks. And I think this one's really up Sarah's alley. Another question from our participants. For those with the experience using AI for MSD prevention and having an injury prevention specialist, what were the benefits of AI versus human assessment? I guess, Sarah, have you had any insights there?
I think really like what Nicole pointed on, it really just speeds up the process, right? Instead of things being manual, we can focus our, injury prevention specialists can focus their time where needed instead of spending all this time going through records and understanding what the risks are to really hone in on the tasks they need to focus on. Really, I think it's all about the collaboration, right? We don't want technology and these AI tools taking away, but adding to our programs. So I think based on the size of the organization and how you have your MSD prevention program set up. It's really about how can you use these AI tools to help things, progress things, and also both treat and predict these risks ahead of time.
Great. Okay. Thank you. We do have another question. I think this is targeted towards Nicole, but also Sarah, I'd like you to weigh in as well. Excuse me. So it says, Nicole, how were you able to gain support from your business to get software for ergonomics? Did you have support from management at the plant or executives at a wider scale? They indicated they struggle for the business to put money or efforts since it's not always an obvious compliance requirement.
Yeah, that's always a challenge to show what that good return on investment is. No, we've had a fairly established ergonomics program with centrally funded ergonomic tools for many years. So this was kind of more of a, even though it was a little bit more money for the AI-based tool, we've already had that funded as a program requirement for quite a few years. But if you're struggling to find another way to sell these ergonomic programs, is to not only focus on the injury prevention side of it, but is also to focus on the productivity gains that you can gain from ergonomics. So find a few case studies where you found an ergonomic solution that helped speed up a process, because managers and leadership, they're all about, especially in manufacturing, if we can do a task faster and more efficiently, that's going to be less labor hours into your product, which is going to give you a higher profit margin on your cost of goods or services. So an example, if you're always having to bend all the way down to the floor to pick up a box and put it out to the top shelf, that's going to take several more seconds, maybe even minutes over the course of a day than if you had something that was at chest level or your forearm level in your power zone to a rack that's at that same height. So you can time those ergonomic improvements and get an overall better time and kind of correlate that to labor savings, and then say, hey, maybe this is a way we can do the return on investment. So that's another way to use other tools, not to minimize the amount of ergonomic risk reduction, which is very important. But if you're not seeing a lot of those injuries or you want to be more proactive, definitely use some other metrics in the business.
Yeah, and I'll add on to that. I think it's really kind of a two-pronged approach, right? Like we need, as a practitioner, I understand that we need leadership buy-in for these ergonomics programs, but we also need buy-in from the frontline workers. So if we can showcase to them and get their buy-in to understand that, hey, this tool can actually help you not only work safer, but potentially faster, do your job better, improve quality, improve safety. That's something that management's going to like. The other part is really the buy-in for the technology portion, right? So I think that's where Work to Zero can help with that. There's a lot of tools, whether it's digital readiness or understanding what a pilot looks like, to really showcase not only how the technology can help you, but also to gain buy-in and trust from the workforce.
Okay, great. We have actually several more questions, and I know our time is growing short here, but we're going to do our best to get through all of these. And I think this one question was really from a participant who has been a human tech user for a number of years, and they're looking for, that next step. Where can they, so, and I guess how they stated it was, can more be shared on the camera image that continually monitor and alert employees? In other words, if there were permanent cameras in the area, can it be more predictive, getting to that predictive analytics piece? Which I think both of you actually talked about. That's kind of future state. I don't think we're there unless, if you can, Sarah, you want to chime in first?
Yeah, I think we're getting there, right? There are definitely some technology softwares out there that can help us predict what's happening and also help feed information into the system for the practitioners to understand where they should focus their efforts, whether or not this is a potentially high risk or not. I also touched on medical management and understanding risk factors and how people are returning to work. So also using those types of technologies to ensure that they're entering a task or job that isn't going to increase their risk as well.
Okay. Great. A specific question for Nicole. Did we try wearables?
So we were getting some momentum with wearables, particularly exoskeletons, and some monitoring to see if exoskeletons were going to be a viable solution for us. We were getting a lot of momentum, and then that was early 2020. And of course, everyone knows what happened in 2020. So once the pandemic hit, we put the exoskeleton on the back burner because obviously for good reasons, people didn't want to be trialing different suits and just for hygiene kind of purposes. So unfortunately, we have not had a ton of experimentation with that. And even post-pandemic, we're not sure if that's going to be the best solution for us, just because we have a lot of people in our factories. They move around a lot of different jobs. We have a lot of new hires. So just the logistics of how we would manage the exoskeletons and some of the other wearables, I think it just is another annoyance for employees if they have to wear something. They may have a more of a resistance, like, oh, Big Brother's watching me if I'm wearing this. So we haven't gone down that route as much. Not to say that those other companies have not found success for that, but for GE Appliances, we have not done a ton of diving into wearables very much.
Okay. Great. So another question here: have you found the AI tools to be helpful for predicting office worker MSD risks? And that's for Sarah and Nicole. Sarah, you want to start?
I will say I don't have experience with office work AI tools yet, but I'm sure that we could probably find some resources on that.
Yeah, same here with I don't know if human tech is built for office environments per se. So we haven't explored that. We do have an Office Ergo program, but it's a little bit more kind of the traditional manual observation checklist type of thing where we recommend new equipment for employees, but kind of more the older tools. But I haven't done a ton of exploring, but that's an interesting idea to see what tools are out there for Office Ergo for sure.
Yeah, I know specifically for NSC, we do have software, and we're looking at new software that can be used as almost a training tool for Office Ergo employees, right? So reminding me to take a break, reminding me to stand up, those sorts of things. So not necessarily telling me what the risks are or if the person's at risk, but just as a training tool.
Okay. So let's see. I know we're coming up on 1 minute left. I think one of the things, a couple points from some folks. Human Tech, as indicated in the chat, is owned by Velocity EHS. It's been a few years. According to one of the participants, they're indicating that 3D motion capture will be included in Velocity systems soon, which sounds interesting. And okay, I think those are the main questions. I guess, Katie, I'll turn it back over to you.
Yeah, so Sarah, Nicole, Mike, thank you for joining us today, providing your knowledge and expertise on this topic. Also, thank you, AIHA, for partnering with us again for another great webinar. And thank you all to all the attendees for joining us today. But that's all we have for today, and have a great day, everyone.
Thank you.
Thanks.